Did you know that your brain and your body can literally learn to feel more pain over time? But the good news is that just as you can learn anything, you can also unlearn or relearn so that your pain doesn't become something that's persistent, that becomes chronic. And even if you do already have persistent or chronic pain, it is something that you can actually change and repattern your nervous system to do so that over time you actually reduce the pain levels and increase your pain tolerance. So today in our video, we're going to dive into the psychology of pain and a little bit about what this pain feedback cycle looks like that goes from acute pain into chronic pain. So stay tuned. Hi everyone, my name is Elena Yang and I am a certified yoga therapist. I bring you yoga that is nourishing and accessible so that you don't end up with more pain afterwards. And like I said, today we're going to dive into pain psychology a little bit and what gets you in this persistent pain loop. And then in the next video next week, I'm going to talk about how you can get out of it. So be sure that you're subscribed to my channel. Click that button below so that you can stay up to date in the part 2 of the Pain Psychology Explained. And also the following week, I'll be giving you more practices such as breathing practices and yoga therapy practices to help you reduce pain and inflammation. So being human is to be able to experience pain, joy, grief, anger, and all these kind of emotions. And whereas pain is a very physical and real sensation, it is actually multidimensional as well. For most of us, when we think of pain, we think of something that we usually want to avoid. We don't want to be in physical pain, whether that's an injury or damage to tissue, nor do we want to be in emotional pain, whether that comes from grief, loss, or heartbreak. So as you can see, pain is multi-leveled, multi-dimensional, and today I'm going to focus just on physical pain. And even in physical pain, there's so many layers and so many dimensions to it. First of all, let's classify the 2 types of pain. The first one is acute pain. Acute pain is pain that lasts less than 3 months. Maybe it's you stubbed your toe on the door frame and it might bruise up, maybe it bled a little bit, but it might be bruised for a few weeks, a few days. And over time, it'll just get better, it'll heal itself, and one day you wake up, it's not there anymore, it's not giving you pain, and you just kind of forget about it. Now, the second type of pain is chronic pain or persistent pain, and that's a pain that lasts for more than 3 months. So in this case, your stubbed toe, just to go back to our first example, will continue giving you pain signals, despite the fact maybe it's not quite as damaged anymore, or maybe it's completely healed, but your body and your brain is still registering pain sensations. Now, before I go even further, I just want to make a note to you and confirm that I'm not saying pain is in your head. I know this is traumatic for many of you, and I just want to validate that your pain is really real. Persistent and chronic pain is a real change in the chemical pathways of your body and in your brain that makes you feel differently. So all these sensations, they are real, but just because you have a change in these chemical pathways doesn't mean you can't undo it or edit it or change it back. So hopefully that gave you some sense of security, and now that we're on the same page, I'm going to continue to explain to you what happens when pain persists. Like I said before, pain is a multi-dimensional experience. Not only does it come from a damaged tissue or body part such as your stubbed toe, it can also be intensified or reduced based on your past memories, based on your experiences, based on your emotions, and also in the environment that you are in. So for example, if you were to stub your toe in your own home, in a safe environment, your pain is probably not going to be as strong. because you know that you're in a safe environment, you know that you can rest if you need to, you know there's a first aid kit that you can apply to your stubbed toe anytime. You're not in an environment where you're in immediate danger, and so you can tend to it, you can remedy it, and you can rest if you want to. Now, on the contrary, if you are hiking through the woods, for example, and you stub your toe in the same way to the same level of damage in the tissues, you might actually feel more pain because you're in an environment where it can be unsafe and you may not know whether you can walk out of this forest or not. And maybe you don't have enough of the first aid kit on you, or maybe you don't even have a first aid kit on you. And so because you are put in a more threatening environment, your body and your brain might actually react with more pain signals. Ultimately, pain is a signal for your body to do something to get you out of this danger. So it's not a bad thing. It's actually trying to protect you. But the problem comes when this protective mechanism becomes a little bit more sensitized. Just as any alarm system, it can become sensitized over time or become a little faulty over time. And so it's not really because something's wrong with you that this alarm system is off. It's just like any machinery or any device, it needs to be recalibrated. So the environment that you are in can have an influence on how much pain you experience, but your past emotions and memories can also have similar influences. So going back to the stubbed toe example, perhaps you have a memory of once upon a time when you were a little child and you stubbed your toe and had a horrible experience with it. Maybe it got so bad and got so infected that you thought you were going to lose your toe and you were kind of traumatized by that. And that memory kind of lingered on, that fear kind of lingered on. So now as a grown adult, you stub your toe again in a similar way as you did when you were a little child, and you had that memory of it being really bad, being a horrific experience, and that can actually influence your pain signals as well. It can influence an increase in your pain sensation because of this fear, of this memory, of this anxiety. Not only can your body and your brain be sensitized to pain over time as a result of repetitive irritation to the tissues or repetitive damage to that same area over and over again, it can also become sensitized over time as a result of being in prolonged states of fear, anxiety, feeling uncertain, and feeling like you're not in a safe environment for your body to heal. And what unfortunately can happen is that this sensitization can feed into this pretty vicious feedback cycle where you are afraid to get into more pain so that you stop moving as much. And because you're not moving as much, your body actually gets more achy and stiff, and that actually creates more pain from the physical level because of the tension in your joints and in your muscles, and just from not using your body for prolonged periods of time. But because of this fear of pain, that actually creates more anxiety, more perception that your environment is not safe, which then actually feeds back into increased pain perception. So remember, pain is a signal for your body to do something so that it can get out of danger. So over time, you might start to see your environment, even your home, become something that's hostile and even dangerous. Maybe because you have to reach up to grab something from the shelf and you know that your shoulder just can't handle that kind of extension. Then over time, you just really become afraid of that shelf and of any action that even minutely brings your arms or shoulder in that angle. And that will just feed back into giving you more pain cycle, then more anxiety and fear, back to more pain, and back to more fear, anxiety, and so on and so forth. So like I've said before, in a way, your body is just a little bit too smart and a little bit too good at protecting you. So it's not a bad thing. These are inbuilt mechanisms to protect us from harm. But we just need to get us out of this loop, because your body's really good at creating these loops, and we need to get out of this loop and start to retrain ourselves and retrain our brain to see that our environment is not all that dangerous, and there are certain things we can do that won't create a lot more pain and actually can help us in the long run. The good news is that you can change this and you can unlearn this pattern of being in this pain loop, but it does require dedication and commitment and definitely a little bit of work at the beginning. And one example I really like to give to many of my clients is that imagine there's this favorite trail that you like to take in your part of the forest or wood or mountain, wherever it is that you like to go hiking. And this trail is very well marked because of your constant use of it. So the trail is smooth, the grass is not overgrown, there's no bushes or trees that are blocking it. So you take this trail because it's easy, it's well marked, you're familiar with it. But one day, as you're walking along this trail, you realize that a mountain lion has decided to take its residency in this cave that's right by the trail. What do? Do you continue going on that trail even though you know that you might put yourself in danger and harm? Of course not. You change the path. So maybe you start to pave this new path by walking along some grassy areas, and maybe at first you have to hack away physically some of the grass and bushes so that you can make a marked trail. But over time, the more you go through this trail, the more that you continue down this path, the wider it will become, the smoother the trail will be. And over time, might be a rocky and rough trail to walk on because it really wasn't a trail before, now suddenly becomes a really well-marked, smooth, and easy trail for you to go on. And this is the same as rewiring and repatterning your brain and body to recognize that not everything around you is dangerous and harmful and will damage your body or tissue. So I hope that helps you visualize and understand a little bit more about how persistent pain works and why we tend to get into these cycles and loops with persistent pain. Now, next week, I'm going to talk about some ways that you can get yourself out of this loop by making this new path, paving this new trail. So make sure you subscribe to my channel so that you don't miss the next video. And if you have any questions, you can drop them in the comments below or email me at elaineyogatherapy@gmail.com. All right, friends, I will see you next time.